Turning our attention now to the ASX, here's Matt Birney and Bulls and Bears with the latest public company views and interviews.
Welcome to Bulls and Bears, brought to you today by Biotech company Radiopharm Theranostics, ASX code RAD. I'm Matt Birney and I'm joined now by the Managing Director of Radiopharm, Riccardo Canevari. Hi, Riccardo.
Hello, Matt. How are you?
Good. Okay, so Radiopharm focuses on imaging and identifying cancer cells and then killing them by delivering small amounts of radiation directly into the tumour. The company has built a pipeline of potential treatments over the past year, and the latest, called F-18 Pivalate, has recently been trialled on cancer patients in the UK with some positive outcomes. Okay, Riccardo, before we get into that trial, and without getting all scientific on me, what problem are you trying to solve with F-18 Pivalate?
Yes, Matt. So brain metastasis is a large issue for patients living with cancer, and we are trying to better image and then treat brain metastasis.
Okay, so you just completed a trial in the UK using F-18 Pivalate, that cancer treatment. How many people took part in that trial? What was its goal and what did you learn from it?
What we want to try to show is that F-18 Pivalate is able to cross the blood-brain barrier, arrive to the brain and detect where the brain metastases are, and then allow physicians to use a PET scan machine to understand how the brain metastases are growing or shrinking based on the therapies that they use.
And what were the outcomes of that trial? What did you learn from it?
The outcome is amazing, Matt. We have positive results in a phase 2A trial showing that F-18 Pivalate is showing exactly what we were expecting to see. Brain metastasis images of high quality and very well differentiated.
What cancers do you think this treatment might eventually be used to target if you can fully prove it up?
We want to conduct a phase 3 trial to prove that the physician can detect and then follow how the brain metastasis responds to therapy. And today they don't have any better tool, the MRI. So this is a potential advancement in having a better approach in detecting and following the brain metastasis.
So it's all about brain cancer at this point in time, is that right?
This is correct. It's a specific type of brain cancer. They are called brain metastases, are affecting patients that unfortunately can have breast cancer, prostate cancer, lung cancer, and all of these sometimes they metastasize in the brain, and at that time are very difficult to be monitored or treated.
Riccardo Canevari from Radiopharm Theranostics, thanks for joining me on Bulls and Bears today. And remember, we're only here to give you information, not advice, which you should seek independently. I'm Matt Birney, and this is Bulls and Bears.
For more public company CEO interviews, go to the Money page on the 6PR, 2GB and 3AW websites and click the Public Companies tab.